next one is by Dr. Marina Bachurina. We've been in contact for quite a few years, but never actually met face to face, so this is a special moment for me. So very happy to have you present after trying to make things happen previously. And yeah, Dr. Bachurina is based in Denver, Colorado, and has used the device for 7 years and has an awful lot of experience to share. So please can we give Dr. Bachurina a warm welcome to the stage. Thank you.
Thank you. So first of all, I want to say it's such an honor to be here. And yes, I agree, first time we're in person with everyone, but we was in contact multiple years. Excellent team to be have them as a support. I have multiple devices in my office, and support with the NeoGen was incredible. Any technical issues, they are right there. Looks like you never sleep. That's for sure, because it's a big time difference. So thank you so much. So they let me to speak here and also share the experience with the NeoGen. NeoGen I adopted briefly about how it happened. And before I start, I would like to have this presentation more interactive. I would like to know who has NeoGen in the office, what team I'm. Okay, so pretty much, no NeoGen? Oh, you work fine. Okay. So pretty much everybody has here NeoGen, so I will be structure my presentation this way. Briefly about me, I'm coming from Russia, medical school, dermatology, finished internal medicine in Drexel University in Philadelphia. Moved to Denver, why? To ski. So don't ski so much right now. But I did a lot of, then I decided to open the clinic and do the dermatology, internal medicine, and aesthetics there. And one of the devices ended up in my hands. It was NeoGen. At that time, NeoGen was not well known, basically no support. We met later, right? All discoveries was self-learning. Try, fail. Very rare fail, but in succeed. NeoGen is amazing if you consider to have one. It's a great choice, and it's one of the main devices in my office. So I have also IPL, nanofractional, and I have radiofrequency tightening. So I use NeoGen as a main device for the resurfacing, for full resurfacing, scar treatment. That's why I choose NeoGen, because it's pretty much application can be from the top to the bottom with NeoGen, and it's very safe. I did not have any complications with NeoGen. Not when I treat with the eyes, did not have any complications. No complication with the damaging of the dermal level. Everything was pretty good, and the patients was pretty happy about that. So in the dermatology, I use in dermatology a lot. I treat a lot of keratosis. I treat rosacea. I treat acne scarring. A lot of scars, the different simple scars, keloid scars. I use the NeoGen as a combination of the therapy. And that's a great results. And it also has I will share my techniques, how I treat post-op, how I do the pain management. So maybe some of you guys also share your experience as well. Do up.
Just the arrows.
Down, right? Okay. So as I mentioned, the main indication is from the top to the bottom. A lot of NeoGen I use for the treating eyelids, scarring, face resurfacing, and rosacea is pretty good treatment as well. Stretch marks. So first, and I will go based on the cases. As a first case is a non-surgical eyelids lift in treating the periorbital area. I go outside of the, if someone came for the treatment for the eyelids, and they will sometimes ask just treat eyelids, I will choose the NeoGen for that. But I will also go beyond of the eyelids, periorbital area, almost to the middle of the cheek as well, and in temple areas as well. So this is the 65 years old Caucasian female, which is pretty much non-significant past medical history, relatively healthy. Also, I do bioidentical hormones. She's in the bioidentical hormones, growth hormone peptides. So I try to make sure also patient has good experience with a post-op, better tissue to be rebuild for the patient. And as well, I am using plasma-rich platelets. I will extract the platelets and I apply in post-procedure. Mm-hmm.
Do you feel that someone who is on HRT has a better result or has any effect on their result at all if they are on hormone replacement?
I will say that definitely they're healthy people. So a lot of BHRT I use testosterone. Testosterone is considered to be anabolic, right? So tissues, skin, muscles, bones, it's a relatively used. Testosterone is definitely shows faster recovery. Yeah, so I will say, and also I use the growth hormone peptides. So as well, simorelin and pomerelin, and I use BPC 157 as the the majority of my patients who undergo NeoGen, they will be using those peptides. Yeah. So as I said, this patient was, she's 65 years old. This treatment, here I use 3.0 and multiple passes. Post-op, so I will use the 3 passes on this patient, and I will start, and before the procedure, I will be injecting with lidocaine. The light, no, have a light. So this is the before treatment. It's after treatment. So I treat. I will cover it the eyebrow with a gauze, wet gauze, and I will cover it the. Also the they will close the eyes. So and I will cover it with the gauze eyelashes. So I will expose all entire upper eyelid. I will start injections. I will start injections from here in approximately 0.5 centimeters and go like a pearls. Superficials, like will be like, you can see like bubbles of the fluids. So I don't put topical lidocaine on the eyelids because it can leak into the eyes, and it's, I said before, it's alkaline base. I had some issues, conjunctivitis, and also had a cornea damage once. So I stopped doing that, and I do use 0.5% of lidocaine, and I will be injecting as a pearls all the way through all the area, which is I'm planning to treat. I give approximately 5 to 10 patients to just make sure that is the anesthetic works very well, and I start to treat, and I go in the lines, and I do the overlap approximately 20%. Overlap. It's hard to predict, but I know we all focus on the how much energy we apply, but also knowing skin very well, I see what is the changes I see. I don't know how many of you did the eyelids, but I see the linear contraction of this tissue right here. It's become like straight like a line. It's become straight. So it's like linear contraction of the surface. So I watch for that, and I see the some caramelization, then I stop.
Sorry, when you see what?
Caramelization of the skin.
Caramelization.
So it's like dryness, and I will point where is the caramelization in another slide. So that things I watch for the eyelids and see if I see those changes. It's like skin goes like this, straight line. So from droop, because of the temperature of the tissues, it contracts, and it's like a string. Boom. So that's what I watch for. And I watch for the skin change from the pink to the like burgundy level. Then I stop. Okay, so in the same, and I go to all the outside of the orbital area to this area, so mid cheek, all will be treated if they just come in for the treatment of the eyelids.
How many pulses would you say in that treatment?
3.0.
Sorry,
Yeah.
the number of pulses roughly?
200 to 300 probably. I will be using that from the tip.
So 200 to 300 for both eyes or one eye?
One eye.
One eye.
One eye.
Okay.
And again, so different damage of the skin, different amount of the pulses I use. So I'm looking for those changes on the skin. So, and as I said, more you do NeoGen, better you become. Follow up with your patients next day, following day. When I started, right now it's less. I'm asking them to send me pictures next day, following day, and almost like up to the 1 week. Then I'll bring them and I will look at the any issues. Because also it helps them to prevent themselves go to the bathroom and do the experiments. So, and you can see the changes. That's why I'm not a fan of the Fraxel, I know the next door. So, and because you don't see post-CO2 treatment that glow. That is the key. That is the key of the why NeoGen is so superior to other devices, because it leaves you with such intact structure, but also boosts the elastin and collagen underneath of the skin. And I think when the portrait was there, they did biopsies. I don't know if the England went to and did the biopsy, but portrait was the one of the similarity of the treatment, and there was a biopsy done. So they did this, see the structure of change of the elastin and collagen stimulated by the plasma treatment. And that's the architecture of the skin, and that is a key. When you have a dense collagen and elastin, you hold more water. If you hold more water, you see that reflect of the light. So that you hold more water, you look younger. So you're feeling the small wrinkles with the fluid. So it looks better. And definitely the texture is better. Cobblestone, this is the first signs of the aging of the skin. You see this cobblestone looking skin, so it's definitely improvement of the skin after that. Okay. Usually I don't bring them earlier than 4 weeks. This case, and I will talk about a little bit about a full face treatment, and I says I don't have just NeoGen in my office, and I do treat face. And when I treat face, and I use multiple devices, but NeoGen again, it's superior, and it goes one of the main device in my office. Some things you cannot treat with NeoGen, and we all know that, like vascular damage. We have a YAG, or we have the IPL. Love IPL, dinosaur device, but it's the best device you probably should also have in your office. I treat vascular damage with that. A lot of those patients will have keratosis, seborrheic keratosis, stuck on, barnacles. So you cannot treat as much with NeoGen, or we'll probably need multiple treatment with that. After NeoGen treatment, I touch them with electrocautery on the treatment. I remove, with the needle, I remove that barnacle. So I do treat the face. And whatever I can use to make it look perfect, and the best result of NeoGen to shine, I use some other things which can be able to complete the picture. And this is how you stand out the crowd. You do face, you don't just use NeoGen. You applying, but also you helping with the other devices as well. Okay. So that, and there's like, this is one of the, and will be later on also show, was the lentigo, which I was being able to remove with the use of the IPL, then also the electrocautery to touch, because it was, and the borders was some keratosis was building up. So at the end, beautiful skin post NeoGen treatment, and also flawless from the pigment changes as well. And she had some vascular changes, which I used the IPL for that. So, and this is another eye, and it's like approximately 4 weeks treatment out. So you can see it's the main things when you see more you apply energy for this type of the skin, like we are talking about, we can go between 1.0 to 3.0. More contraction you see if you use the 3.0 on the skin. So anesthetic, yes. Injectable anesthetic, yes. Pronox, yes. If you can give pain medication, prescribe, yes. It's a very intimidating process for the patients to treat the eyelids, but you can see more you apply, better contraction you see. And it's so safe. Like top layer contraction, stimulation of the terminal effect on the dermal level, stimulate collagen without burning through the columns, without burning columns in the skin to cause that. That is incredible. Mm-hmm.
On the other picture, were
Uh-huh.
you seeing the same energy level and the same
Yes.
on the under?
Yes, I do the same, yeah. Mm-hmm. Sometimes, as I said, I standard, right? 3 passes, whatever energy I choose, but I wait for those changes of the skin, because sometimes you need a little bit more, different layers of the, different thickness of the epidermis, because it's all about dispersion of the energy with NeoGen. You have to see it. More you do, more you will understand and better you become with the operating on this device. And when you follow up, that is important key of the learning. Follow up with your patient. What happened to skin when you use this amount of energy? Okay, it's important. And they also patient appreciate that, because they don't look pretty next morning. No, I say that you will have raccoon eyes like for 1 week. So the big brown spots around the eyes. So yeah, this is the first day. This is the usually swelling happens to this extent, approximately end of the second day, third day. So you have to warn the patients when you apply high level of the energy, it swells up. Okay.
Do you prescribe anything, or do you tell them to take anything over the counter to kind of help with
Yes.
that, or you just?
For 2017 until today, I do use elastin, regenerative nectar, and only one thing I use. Tried everything. I had so many skincare representative in my office. I did try it. I had access to many. Elastin nectar. I even met with them. One thing I wanted to change in their structure is a more thicker, because it's very thin. You apply and it feels like it's nothing, but you just explain as this is how they're going to feel for the next days. But they tried everything, and I am for so many years, patients will not do the NeoGen if they don't have the nectar, purple one, not green, purple. You guys using the elastin? Yeah, so I did 3, level 3, 3.0. Any resurfacing will be, they will be any level of resurfacing with NeoGen, they will be using the elastin nectar. It also has a comforting effect. No, it doesn't helps with itch, helps with the pain, swelling. Yes. Neova, is it similar?
It's very similar. It's only one.
This one I did not try.
It's more cost effective for the client or the patient.
Mm-hmm.
Elastin, but it is very similar to it.
If this is, did you try like one face, half of the face was that? If so, this one I did not try. So I don't know. I don't know that if this works in the same effect. Yes, because it's very uncomfortable. First 3 days is very uncomfortable. It's swollen. It's red. It's like 2nd-degree burn. So that's I will not recommend any Aquaphor, because I feel like Aquaphor will cause more acne. Purging, yes, happen, but shouldn't be really happen after the NeoGen, because it goes to such a deep layer and kills all bacteria which is present on the skin. So it's a strong antibacterial effect of NeoGen. I used before Aquaphor first day post-treatment, and I found that it's cause so much occlusion effect and build up fluids underneath, so skin pretty much slough off. So elastin is very light, elegant, and doesn't have so much water. It doesn't cause the occlusive effect.
How often do you recommend?
So at least 3 times per day. Yes, because it's very expensive. I agree. It's a pretty expensive product. I will say every 2 hours probably they will be using in the first couple of days. Every 2 hours. And they will go sleep using that and probably hopefully fall asleep. Tylenol, yes. Ibuprofen, I will say stay away. From ibuprofen, I don't prescribe prednisone. Prednisone, any kind of steroids. I will tell them just try to wait it out. Mm-hmm. Yeah, so this is the similar case. It's the periorbital area, eyelids, non-surgical lift. She had a full face of the NeoGen, but I wanted to show the case just case with energy. With energy, we did 1.3 and the three passes. She doesn't really have a hooded xanthelasma, so this is one is a combination of therapy I wanted to show. She had a full face of the treatment with the NeoGen, but my focus was today is on eyes, periorbital area, and the eyelids lift. Maybe escape. Yeah, so this is the before the treatment. So she doesn't have like another case, right? So she had such of hooded eyelids, so it's more actually volume loss here. So you can see the changes. So this is the before the treatment. This is after. So you can see the changes also above the eyebrow, and she has xanthelasma, which is I have been treated. First I did a NeoGen, and I brought her back. And I remove it with electrocautery. So I do the intradermal injection with lidocaine, and we'll remove. The same principle of treatment of the eyelids, the same the lidocaine injections, periorbital, and the 1.3 energy 3 passes. So in my observation is for so many years, I feel like low energy they can tolerate better than 3.0. But when you layer 1.3 3 times, it's almost like you see the changes on the skin like you're doing with the 3.0, 1 pass.
Just to be clear,
Yeah.
you're saying 3
Passes,
of 1.3
1.3.
is equivalent to
I will see this. I see these changes when you are pulsing with the 3.0. You see the changes on the skin, how quickly it contracts, and also causes some of the saging, right? The caramelization, white spots. I see the same result of the changes of the skin because this is what I'm looking for to get the results. 1.3 3 times in the same spot.
for the
Like,
patient can tolerate the 1.3
I feel like
more than the 3?
Yeah, I feel like they are better tolerating that. Better. That's pain-wise as well. So another application is we use the keloid in simple scar treatment with the NeoGen. So she's a 55 years old and bioidentical hormones, growth factors as well, growth hormone peptides. So she had the knee replacement and she had sutured the upper part of the surgical scar was sutured to the underlying condition. So she came week after the procedure. So this was before, right? So this is before. This is the part. So this is her knee, right knee. And she was concerned about this hooding, right? And this is completely was like sealed to her underlying, and they were not able to move. Not right, not left, not up. So it's absolutely sealed, and all the scar through the knee. So this is the caramelization I'm talking about.
So sorry, I can't read it. How soon after was that?
Right after treatment.
Immediately after.
Yeah. So that is the treatment. So this was my focus is to cause thermal damage on the surface and make these tissues softer. So she was also instructed to, after probably the few days, to try to also move right and left underlying tissues with that. But application of the 3.0 in multiple passes. To treat that with such of energy, I had to anesthetize all this area. So I used the 30 gauge needle, 0.5 lidocaine. It's plenty enough. You don't need to go to %. You don't need to go to I will say don't use the epinephrine because cause vasoconstriction. You want to have a good blood supply to any tissues treated with NeoGen. You have to have a good blood supply. So I did inject it all the way through both sides, and I treated scar, and I was going outside of the outside of the scar tissues, and this is what I'm looking for. That skin becomes yellow like this. Okay. That is the bottom of the bottom of that scar. So I do use PRP. It's very easy to use, very easy to do. If you can if you know how to take the PRP. I do apply PRP a lot after the NeoGen treatment. Right after the treatment, I will apply, because permeability of the skin is very high. Right after the treatment, I will apply the PRP on the face. I do inject with PRP as well under the eyes. If the patient wants to have a lift, I will do the also PRP lift of the patient, but if they can tolerate the pain. So right after, that's why the combination of the treatment results is better when you are using PRP as well. So it's immediate application of the PRP, and this is the surgical tape.
So you like PRP better than something like exosomes?
Yes.
Yeah.
I don't know if yes, I know exosomes is this is cost me probably $15. Exosomes is 1,000, right? Something like close to the vial will be 800, right? This is autologous, is the no allergic reactions, is the patient. It's like it's in multiple folds of growth factors, cost effective, and I'm for the cost effective. Anything for the patient. Not all patients can afford those procedures. So I apply PRP. It also helps with the wound, especially the wound which is post NeoGen treatment. It's high permeability. Also, I use the 5 cc of the PRP, and I inject under the scar. This is the
How long do you think that those microchannels stay open?
well, so PRP seals them right away. So they're not open. So the PRP goes in and it dries out. It's almost like using egg yolk on the skin. So it's a seals in. I use the same PRP, like PRP and macroneedling, same effect. Seals right away, and you want it. It protects our skin as well.
I can just make a comment on the absorption rate. So within the first hour following treatment, for an experiment we used ascorbic acid, and the absorbency rate was 8 times within the first hour of untreated skin. So treated skin absorbed 8 times as much ascorbic acid in the first hour, and then it tailored off. Yeah.
It's the permeability is pretty high, but also unique about NeoGen, right? So permeability is high, but also keep that film on the top, so it protects from the other infections. But putting PRP after the NeoGen, I think it will be also protect even more because it's a sealing in. It dries out. So surgical tape, yes. Oh, this is the same. Somebody asked me about stretch marks. Treatment stretch marks. Same application. It's like almost like looks like Christmas tree. So application was this way and the other way. It's very important that you have a gaps. This is where I put elastin. So this is surgical tape, and unique about that, we all know it has a small micropores. So application of elastin can be happening without removing the tape, and this is the key for the treatment with such a high energy. Because if you start to remove next day or second day, skin will come off underneath. So key is use this surgical tape as a matrix to rebuild the new skin, flat. So she can use the shower, and I told her to remove this tape in a week. Okay. Yeah, so the next morning, 2 days, you see this plasma seeping through her own plasma from the post-treatment. Yellow, doesn't look pretty, it's totally okay. Tell the patient it's totally okay, it shouldn't be hurt. If you start to have a pain, it means secondary infection is there. Post-NeoGen, should be no pain with this type of the energy because it's ablative, will be treatment. Second degree burn, they shouldn't have any pain after that, but if you have a pain and a redness around, so probably will have secondary infection. But for so many years, did not have a complications, secondary infection with NeoGen. No. And I don't know, did you see, was able to have a video? Oh no. Yeah. Oh yeah. A little bit longer. So I'm look for those changes of the skin. So it has to be like literally you feel the skin becoming hard like a paper. Very, very hard. Not soft, not smooth. It's like become rough. This is the bottom of the skin. So this is the changes on the skin I'm looking at. Saging. And this is the four weeks post-treatment. So this area become less hooded, more flat. We treated whole. Okay. So this is another case. I have a patient who is 50 years old, and he has it's interesting, few things here to look at the hyperpigmentation changes, if there any, how they looks on the patient who has the 3.0 Mediterranean, right? Mediterranean 3.0. He had a melanoma, diagnosed him with melanoma, did excision, wide excision, it's linear, spread it out. We're trying to do the also treatment of the scar. So right in the middle is more floppy and very thin, and this is how it looks like. So that this is the beginning before the treatment. And this part is if you put them together, so it's very, very thin and very, very gentle skin compared to the outside and normal skin. So this is right post-treatment. So this is the Mediterranean and this is 3.0. So you can see these changes. It's becoming really burgundy, and this is the one what I'm looking for as well. And shines, contraction of the skin immediate. This is saging. So this is the further treatment for the adding more treatment for the more layers. So this is another stage. This is what I'm looking for. This is where I stop. And this is what happened to the scar. As 1 or 2 weeks later, he sent me that picture. This is what happened to the scar underneath when you remove the tape. So immediately application of a tape and elasting. And this is how scar looks. So this shortening, definitely shortening of this area to the more narrow. And it's more thicker. So the skin become more thicker here. And it's he's the same it's in his back. So I did biopsy and become keloid scar raised. So I treated with multiple pass and 3.0 until it's pretty much it's a few weeks later, it's become flat. It's just right there. So the total did not use electrocautery on that, but I used the NeoGen, leveled it out. Case 3, 45 years old, Caucasian male, healthy, recently did this case as well. He had experienced trauma to his nose, sharp object, and cut his nose and put it together, so he had a significant scar. And this is 4 weeks post-treatment. 3.0, 6 passes. And this is how it looks when I do that. So that these changes I'm looking at, this is pretty much they leveled, and I can go back, and this is how it looks post-treatment. It's 1 round. I'm thinking about bringing him back and do the maybe again. He's happy because he felt like his nose looks like old man nose. He's telling me. So his girlfriend brought him. He did not know what to do. And if you see that also pores definitely changing the size. So way better. He's super happy. And also if you see that pink, it means that it will get better. The skin will start to regenerate and it's become white like here. It's still early. I see the changes up to the 4 months. 4 months we can bring it back to revisit as well. But this is how it looks. So I tape it. I tape him after that and apply application of the elastin and remove the tape in a week. So the full face rejuvenation, as I said, full face rejuvenation is for me I do apply. I look at the skin, and I say, okay, what I can do here and what device to apply. So NeoGen, as I said, plays big role, but also I will apply other devices which will be treated with NeoGen cannot. So it's like keratosis. I cannot remove with one treatment of the NeoGen, and vascular damage. So I will use electrocautery and I will use the IPL. I will pre-treat with IPL. And also it kind of boosts the skin to hold more energy with NeoGen. I feel like it will be boosting the skin. So, and this is her transformation. So I did the eye lift, and she has a scarring treatment. We was doing that, and overall you can see the changes of the skin with a more glow, healthy looking skin, way healthier. This is the one treatment for this lady. So how she was looking before, and I remember this pigment as well. And this was second day post-treatment. And as a closer look, IPL was applied here. IPL was applied for the vascular damage. I do treatment with the IPL for the nose. It's just overall, NeoGen will be a best investment treatment if you do pre-treat and remove the other lesions like vascular damage. Just overall skin and results looks way better. I do also treat earlobes. It's part of the treatment, not just only face. You guys do this as well, treat the earlobes. So between 1.5 or 3.0 depends. I do inject lidocaine in earlobes and I treat them fully. And this was the before treatment, it's after the treatment. And again, before the treatment and after the treatment. Patients do not like it, but they will explain why. Yeah, they don't like it. Okay. So another slide is about pain management, and pain management was a big problem for us. I will say spot treatment. You can do the topical and wet treatment, wet treatment if this is helpful. But it's pretty much you don't really need so much lidocaine there. When it beyond of the 3.0, I will say local blocks. So you want them to not have so much. It's very painful. I don't use the wet techniques. I feel like it will be probably will be some dispersion of the energy, and not as much energy will be applied to the skin. Dry techniques is more painful, so I do the dental blocks, at least some part, periorbital blocks, I will do that as well. Cautious sedation, I don't do it, but for that one, plastic surgeons can do the cautious sedation. And I think if the patient decided to go on a facelift, do the facelift, the surgeon should have NeoGen. I think results is way better, and they can treat also the less infections post the possibility less infections post the facelifts as well. I think that's it. Yeah.
Thank you.
Mhm. Thank you. Any questions?
I'm just wondering why, when we resurface scars with a ablative fractional, usually use some low density and low coagulation. And I see you use a lot of energy in flat scars. Can you explain to me why it's so aggressive in the scar tissue?
Why so aggressive? I will say with the 1.5, right? 1.5 or below, not 3.0. Heating of the scar tissues is not happening as it happen. Heating of the scar tissues with the 3.0. When you heat up the scar tissues, it causes more collagen production, but also it's improved the modality. It's easier to modulate the scar, which is existing scar. So when you heat up those tissues, so it's more plasticity to that scar.
Usually use, that came in late, I'm sorry,
Mm-hmm.
about 3 joules what you use for a flat scar.
Keloid scar and the scar which I needed to reach the underlying tissues.
Okay.
It's one of the reason one. For the flat, then when I did if you saw in the knee, she has a side scar. It was just only one pass. I did not need to use that. 3.0, I wanted to reach, cause more heating, terminal damage, underlying tissues, because they will be increase the plasticity to them.
Okay.
Keloid, you wanted to, it will be probably hard to do the with a fraxel keloid. You're talking about fraxel or CO2?
No, any ablative fractional.
Yeah, so it's pretty much the caramelizing the tissues of the keloid, removing them if you're using a lot of energy, because it's a very high energy device. So it's a change in if you saw the keloid, just keloid, right? So it's pretty much removed, caramelized and removed.
I'm just talking about the flat scar.
If you're talking about the knee and the flat scar, I don't use the 3.0. If the small flat scar, I don't. When on the knee, I used it because I wanted to move those underlying tissues, because tissues was sutured to the underlying tissues post the knee replacement.
Okay.
On the keloid, I will use it just to increase the heating to the keloid. It's thick, so it has a better plasticity to the tissue.
Yes, when you do the IPL with the NeoGen, which one do you do first, the IPL or the NeoGen, and do you do it in one session?
Yeah, I do it in one session. Yeah, I do the IPL first. It's hard to, and this is what is the IPL, right? It's go after the color. When you do the NeoGen, it will pick up your pink color from treatment with NeoGen, right? You understand what I mean? It will pretty much start to pick up every changes of that red everywhere, where you don't even need it, because you treat it with NeoGen, you have changes on the skin. So you need to treat the IPL with IPL before you treat with a NeoGen.
You mentioned treating rosacea.
Rosacea, yes.
What energy levels do you use for that?
It depends, right, on the patient. I will say my sweet spot is 1.5. 1.5. And I will probably pulse a little bit more on the pustules. Few passes, I will probably paint it with the 1.5 cheek, chin, if there's some in the forehead, nose. Nose probably I will go a little bit step up, a little bit more on the nose. Nose can take a little bit more energy than the cheeks. not as painful.
How about when you address the pores? One of the things that convinced me about getting the NeoGen device is I was actually lecturing in Singapore, and the distributor asked me if I had NeoGen, and I said, no, I don't. He said, do you want to try it? I said, of course. And we tried it in one of the salespeople that was working with him, and some doctor in Singapore was nice enough to lend us the device. And the result that I saw a week after was just amazing. I'll show you. But I was in a different office. I didn't really pay attention to the settings. He used aggressive settings. But I wonder what your settings are for men-like dilated pores, in the cheeks. I know the nose can take a beating, but what's your go-to treatment for the pores here in the cheeks?
When did you hold the handle of the NeoGen? Did you treat the?
No,
No,
no.
you saw there,
I
right?
saw, yeah.
So you will see you're looking for that change. So, and everybody is different, right? So I will say in males, you need to be careful because they are not tolerating pain as well, probably as a woman. I will say, again, between 1 and 1.5, and I will do maybe for the patient will be enough, depends on the size of the pore, maybe one pass or multiple pass. You see the changes on the skin again. You see that linear contraction. And if you see that, if maybe one pass will be enough. In the pores, you can see good results. And you can see right there under the probe when you're treating with that, its pores become smaller. Energy of NeoGen cause linear contraction of the skin. So I explain even patients when I make it easy. Lab coat from size 6 goes to size 4 in the same bone structures.
Mm-hmm.
So this is how they understand, I understand what's a linear contraction because I see that contraction in eyelids immediate. The same happens with the pores. So they shrink right under the probe. But for everybody it's different because some have thicker skin, need more energy to apply.
Thank you. I may have missed this. I came in late, sorry. When you're treating the eyes and you see that immediate contraction, does it stay that contracted or does it relax over time? And what's the durability?
Durability, I will say contraction 25 to 35% after the treatment. I do see this linear contraction after the patient might have a 24 to 48 hours, right? 24 to 48 hours contraction is, then after that it's swelling happen, then deflating state. So you see the eyelid looking just similar to what it has before, and then filling up the state because you stimulate collagen production and elastin. So then the contraction even more happening through the rest of the 4 months. So the improvement, I see the contracted the state up to the 4 weeks, and then again better and better and better. But that immediate contraction is probably will be between 24 to 48 hours. Then it fills in with the fluids. So inflated, patients looks better. So you don't see that linear, but you feel that your eyelids is fluffy and puffy with the fluids. Then deflating state, almost going, they are better than they was before. But after is another state, contraction happen because it's building new collagen underneath.
And how,
But
how puffy are they during that healing stage?
depends on the energy. Again, depends if they have a fillers as another one. Puffy, 3 days.
I'm sorry?
3 days. And the third day, they puffy,
3 days.
3 days. Day 3, the swelling goes down.
Do you try to melt or dissolve the filler if they have filler prior to? I guess
Depends.
not.
So everything will go back to how it was before. If they like it, how the filler looks like, I don't worry about that because there will be a swelling will go down. But if they don't like it, I will dissolve
But sometimes filler can migrate, so,
with the NeoGen.
well, If there's edema, if there, who knows what makes it migrate, but it does. In the
I
periocular
will not
area.
dissolve filler, but if they would like to dissolve, I will be dissolving afterwards.
Mm.
If they would like to do that, it will be independent, probably decision for the patient. I will not think that I will tell the patient they will be filler will be better looking after the NeoGen if they are concerned about that. But I will not dissolve filler before the NeoGen treatment. I will tell them that the swelling goes bigger amount of they will be in this area, right? But I always see it goes back to how it was before.
Great, thank you.